about to listen to the Dr. Dahlia Show. Sassy, stimulating medical talk radio. Any medical advice Dr. Dahlia Wax gives on her show should not be substituted for an actual visit to your medical provider. And now, here's Dr. Dahlia.
Back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877-Dr. 1-877-DOCDALI. So one of our listeners wants me to advise you guys on what is the best over-the-counter medication for cough and cold. What do I like to use the most? And this is good. I have no sponsors, in that realm. So you're going to get the honest answer from me on this. And I don't think anybody should, if they do have a sponsor, give a dishonest answer. I tell you what my go-to is. It's the hot shower. I know that doesn't sound really good, to a lot of, but I've used the Robotessins and the Mucinexes, and yes, they do. I have used them. I've used Sudafed. I've used Dayquil, NyQuil. And they work, but the best thing that works for me is jumping in the hot shower. Now, when I'm sick, I take maybe 6 of those hot showers. Then my husband's like, oh, come on, man. Our water bill's going to be ridiculous. I live in Southern Nevada. Our water bills are just generally, the prices we spend on water is just absolutely ridiculous. But I got to tell you, when I can't sleep at night and I'm coughing, I get up, I take a hot shower. It stops the cough and I'm able to go back to sleep. When I feel congested and I have to go on air, I just, I know it doesn't sound the most exciting. It's just, it works for me. Now, I've also been asked multiple times by patients how they could get a doctor to write the Phenergan with codeine, or the previous remember there was that grape flavored Pan Cough PD. And these cough medications that had narcotics in them, they're still around, from what I understand. I haven't written them in years because the company I work for, you don't write narcotics because you can't write them over the phone, over the telephone. And so many individuals are like, look, I'm using all this stuff over the counter. Nothing is working. Now, why are they saying nothing is working? Well, because then they used to take those medications. It would help them sleep. If they slept, they felt better. Their immune system could build up. If they weren't coughing all night, they weren't irritating their lung linings. And so it was it was something that doctors used for a long time until we had such an issue as it pertained to narcotic overuse, that then we ended up, having to say, no, sorry, guys, we can't write these. Now, like I said, there are still doctors that will write those medications for your cough. It's not ideal, and it's not anything that we recommend. But I see where patients are coming from when they're like, look, I would go to sleep and I wouldn't be coughing and coughing, because right now what you're getting is, if you're having, let's say, a bronchitis, and most bronchitises are viral, and the doctor's not going to give you a Z-Pak for bronchitis. They'll give you something for your cough. They'll tell you to use Mucinex, or they'll tell you to use, or the COVID. Yeah, like if you have COVID, we're not supposed to treat COVID with the Z-Pak. I know some of you claim the Z-Pak made you feel better, and I get that, because I feel better with Z-Paks too. But technically, we're not supposed to treat COVID with a Z-Pak. Z-Paks need to be saved for those people who need it, that have community-acquired pneumonia, or are penicillin allergic and have strep. So we need the Z-Paks for patients that don't have a virus. And so for the cough, you're given Tessalon Pearls or benzocatate, which is a prescriptive strength cough medicine. For some people, it works amazing. For others, no. Then some of you are getting steroids. Some of you are getting inhalers. And I'm noticing, and this is what you're noticing, that sometimes you're given 3 or 4 medications when you feel like in the past you just needed 1 teaspoon. Now, keep in mind How long ago was it when you got that 1 teaspoon? 2012? Remember, you were a little younger back then, so you could bounce back a little bit more. So, my go-to, just, tea, honey, chicken soup. The Jews know what they were doing when they came up with chicken soup for the cold. There's anti-inflammatories, there's the warmth, the fluid, it's just the vegetables. I think chicken soup is, one of the best treatments. But I also remember when I was younger, the reason why we had cough syrups with alcohol or codeine is because that replaced alcohol. I remember my mom saying she won't stop coughing, and my grandmother said, give her some schnapps, give her some schnapps. And my mom's like, I don't have schnapps. My mom didn't have a lot of alcohol in the house. And she's like, I'll bring some over. I'm like, go grandma. And I'm 6 years old going, whew, I'm going to get some schnapps. I got to tell you, it knocked me out. Now, we don't do that because alcohol actually messes with your sleep. And it can mess with your cough reflex. And alcohol is not good for cough. Unfortunately, people who are not accessing a medical provider or a regular medical provider, they're just doing what works for them. And sadly, they're drinking. Or they're using old pain pills to stop their cough. So we talk about cough a lot on the show because unfortunately people, get coughs. And I think there's a lot of things you could do that are natural. That, as I said, humidifier, steam, honey, tea with honey can really help. We could also use, natural remedies like peppermint, thyme, eucalyptus, licorice, ginger can also provide relief, even chocolate. So chocolate has theobromine. Now, theobromine can suppress a cough. And there was a study back about 10 years ago that said it works better than codeine. Chocolate. And I noticed I'll take some chocolate and it'll go down. The only problem is you really don't want the sugar and you don't want to feed illnesses with sugar. But also if you're having a cough and it's not COVID or bacteria related or whatever, it could also be your medication. It could be acid reflux. It could be mold in your house. It could be a heart condition. It could be a lung condition. It could be that you vape a lot. So get that checked out. 1-877-DOC-DOLLY. We are back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877-DOC-DOLLY, 1-877-DOCDALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer, and big thanks to you all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Dahlia, Facebook, The Dr. Dahlia Show, and on YouTube, click like and subscribe. So I keep being asked, is vaping the safer choice than smoking? And the answer is a little nuanced because smoking is bad. I mean, lung cancer is still the number one death, even if the number one cancer. Lung cancer is the number one cancer of all cancers out there still. Even though we've been decreasing smoking, fewer people are now, going to tobacco. They're going more towards vaping. Still, lung cancer is the number one cause of death for cancer. Heart disease is still the number one cause of mortality, health-related mortality. But in terms of cancer, lung cancer is number one. And so many people have been going to vaping because they're saying, well, it's not tobacco. So if it's not tobacco, it's safer. Well, the problem I've had with that is if you were using vaping to get off tobacco, and it was only temporary, I would support you. But if you were unfortunately using vaping to just, I guess, have a new habit, that was a problem. And the reason why is we were starting to see early on that there were issues with heating up the vape liquid, the formaldehyde, and the other chemical components that happen when you heat up a liquid. You also got the metal contaminants from the coil. And so these are, not to mention food colorings and food preservatives. and food flavorings that are not supposed to be on the delicate lung lining. So vaping, in a way, may not have the same risks as tobacco, but I do believe it's risky. And so we recommend, we don't necessarily tell people to go and vape. You're not going to see that recommendation. But what we do say is, look, we want to get you off smoking. Okay? And there are many different avenues to do that. We have hotlines, we have of nicotine patches, we have products that can help you. But the thing is we still have to deal with the nicotine addiction. And so doctors are very reluctant to tell you to use certain deliveries. We have to, unfortunately, be very careful about what you're using in terms of getting off your smoking because of the addiction to nicotine, which we're going to be talking about a little bit. Our next guest is here, Dr. David Tom Cook, fellow of the American College of Surgeons and member of the ACS patient. This is a great segment because when we spoke about lung cancer and how the guidelines in the USPSTF finally suggested that we could CAT scan to screen for lung cancer, this was huge and this was so life-saving. The problem is only 1 in 5 Americans who are eligible to get this screening do it, which means 4 in 5 are being left out. So we're really, really grateful for our next guest, Dr. David Tom Cook. Thank you so much for joining us.
Thank you very much, Dr. Dahlia, for inviting me.
Wow. So lung cancer is beatable if we catch it early. Talk to us about why this screening is so important.
Yes, as you pointed out, lung cancer is the number 1 cancer killer in the United States. It kills more men and more women than any other cancer, including breast cancer, prostate cancer, and colon cancer. Yet, just like we have screening for mammography for breast cancer and screening for colon cancer and even prostate cancer, we have screening for lung cancer with low-dose CT scan. But only 18% of Americans who are eligible for lung cancer screening actually get screened.
It's interesting. Back in the 90s when I was at training and I was doing my oncology training, the doctor told me to chest x-ray all patients who were previous smokers twice a year. And I asked, I go, why couldn't we CAT scan? He said insurance won't cover it. So chest x-ray them twice a year, and insurance might not cover that. We've gone a long way thanks to doctors like you that have been advocating for this. But unfortunately, the word I don't think has gotten out. And maybe it's because people don't have a primary care. Maybe many people use telemedicine instead. And so they're just kind of getting their more urgent needs met. Talk about who qualifies for screening.
Yeah, lung cancer screening with low-dose CT scan looks at folks who are considered the highest risk for developing lung cancer. So those are folks who have a smoking history, who have smoked 20 pack years history. Now, what is a pack year? You take the number of packs per day you smoked times the number of years you smoked. So if you smoke 1 pack per day for 20 years, that's 20 pack years. If you smoke 2 packs per day for 10 years, that's 20 pack years. You're age 50 or older, and you're a current smoker, or if you quit smoking, you quit within 15 years. If you hit all 3 of those categories, you're eligible for lung cancer screening with low-dose CT scan.
And it is so easy. It's painless. It's amazing. And many people think, well, you know what? I'm not having symptoms, so I'm good. Symptoms, you could start having signs of cancer picked up on CT before the symptoms. But talk to my listeners about the signs and symptoms that they should be aware of.
Yeah, just as you pointed out, lung cancer screening with low-dose CT scan is super easy. So the scan itself takes less than 5 minutes. You don't have to take off your clothes into a hospital gown. There's no IVs or pokes for labs. It's up to you if you want to take off your shoes. The scan looks like a donut. You lie down, you slide within the scanner, you slide back out. It's less than 5 minutes. So it's extremely easy. Now, there are some symptoms that are associated with lung cancer or can be associated. That includes unintentional weight loss. a persistent cough that won't go away, a productive cough, so a cough that produces phlegm or blood, new hoarseness, or new difficulty breathing. Those could be signs and symptoms for lung cancer. However, there are plenty of folks who are walking around right now with small, tiny, early stage lung cancers, and those cancers may not be associated with any symptoms at all. That's why lung cancer screening with low-dose CT scan is so important, because it detects those early-stage lung cancers that have no symptoms but have the best chance for cure.
Amen. We're speaking to Dr. David Tom Cook, professor and founding chief of the Division of General Thoracic Surgery at UC Davis, physician and chief of the UC Davis Comprehensive Cancer Center, and member of the American College of Surgeons Patient Education Committee. I get a lot of questions about secondhand smoke and thirdhand smoke. You live with the smoker, or kids are picking it up, from the drapes and furniture. Talk to us about those people who don't smoke and their risk.
Yeah, what we're finding in this country that there are more and more young people developing cancer, and lung cancer is no exception. So there are other risk factors for developing lung cancer. First of all you need to develop lung cancer are lungs, but there are other risk factors. So a family history for lung cancer, specifically first-degree relative, so brother, sister, mother. There's occupational exposure like asbestos and other particulate matter that you might be breathing in. Lung pollution is a risk factor for developing lung cancer. There are things such as elemental gas, such as radon, which are risk factors for developing lung cancer. If you feel that you fall into any of these categories, including the smoking categories that we talked about, or you feel that a family member or friend or loved one falls into these categories, I encourage you to talk to your doctor and say, am I at risk for developing lung cancer, and should I be screened or tested in some way?
Absolutely. We're coming up on the end soon. Any new treatments that you'd like to tell our listeners about? Yeah,
if we look at cancer cures in this country, so people get cured for lung cancer. The cure rate has been increasing in the last 15 to 20 years compared to decades before. Why is that? It's because of wonderful innovations in the way we treat patients with lung cancer. Now we have personalized medicine. So we take the tumor, look at the genetic and gene profile of that tumor, and give specific medications targeted to that genetic profile. We have immunotherapy, drugs that boost your immune system to fight lung cancer. And we have innovations in surgery. Now, 80% of early stage lung cancer is done minimally invasively. The surgery is done minimally invasively with small incisions, high definition cameras, and robotics that allow people to go home sooner and faster back to their jobs and activities of daily living. And in combination of those things.
Dr. Cook, so sorry. Where can my listeners go for more information?
Yes, go to facs.org. That's facs.org/lung cancer. The website, American College of Surgeons. There's a wealth of information there, or just talk to your doctor.
Love it. Awesome. Thank you, Dr. Cook. Can't wait to have you back.
Thank you very much for this invite to talk about this important subject of lung cancer.
Thank you again so much for coming. This is such a huge, huge, huge topic. And, I can't wait to have him back so we could talk more about the treatments and what we could do, and having that precision medicine and that precision sort of treatment. Wonderful. Don't go away. We'll be right back. 1-877-DOC-DOLLY.
Looking for a gift that can actually help secure someone's future? It's Mark Falter's new book, Common Sense Income Strategies. It makes the perfect gift for that special someone in your life. Mark has helped thousands of hardworking Americans secure their financial future by using time-tested strategies that continue to create wealth, whether the market is up or down. Strategies that will make perfect sense once you take the time to read this powerful book. Common Sense Income Strategies brings to you what Mark has been teaching in person and talking about on the radio for decades. You've worked too long and too hard not to see the fruits of your labor. To learn how to receive your free copy, call 866-764-2635. That's 866-764-2635. Secure your future with Common Sense Income Strategies by Mark Falter. Again, to learn how to receive your free copy, call 866-764-2635. That's 866-764-2635.
Hey guys, it's Dr. Dahlia. Fantasy football season is coming, but sadly, too many of you are taking the bench while the country takes part in one of the most exciting and lucrative industries out there. Don't know how to play? Well, huddle up and listen. Paul Kalikas and I have written a fantasy football pocket guide for beginners. This book walks you through the basics and shows you how simple and lucrative joining or creating a fantasy football team can be. Read our fantasy football pocket guide for beginners found on Amazon or follow the links on X and Facebook. That's fantasy football pocket guides for beginners. Don't be left out.
Increase fuel economy up to 7.9% with Hot Shot's Secret Gasoline Extreme, the solution to maximize your engine's performance and fuel economy. Whether you're driving a sports car or a daily commuter, Gasoline Extreme is specially formulated with PEA to deep clean. Don't settle for an average driving experience. Upgrade to Hot Shot's Secret Gasoline Extreme and go further on each tank. Order now on Amazon or HotShotSecret.com. Hot Shot Secret, powered by science.
Hi, it's Mark Falter, host of the Financial Fitness Show. I strongly believe that no one should ever pay 1 penny more in taxes than they are legally obligated. Unfortunately, for most hardworking Americans, this just isn't the case. Why? Because most people spend more time planning next weekend's getaway than trying to ensure they're going to pay less in taxes. My financial fitness team has put together some materials that I know are going to help you. It's the Tax Savings Kit. Tax Savings Kit includes 3 things: free tax analysis, top 10 ways to pay less in taxes, and an investor's guide to taxes. Now, how do you get it? Simple. 866-764-2635. Again, 866-764-2635. I'm Mark Falter. This is Financial Fitness, making personal finance profitable.
We are back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877-DOC-DALI, 1-877-DOC-DALI. So this is a very interesting study we need to talk about as it pertains to abortion and the abortion pills. So now we have the ability with mifepristone and misoprostol to do abortions non-surgically, where one blocks the progesterone and one causes the uterine contractions for people to expel an unwanted pregnancy. And doctors for years have said there are still side effects. I know a pill is a lot safer than a surgical procedure, dilatation and curettage and suction and all the other things that were done to remove an abortion or to remove a fetus. But the idea that these pills are risk-free was a myth and not accurate. And we need to be a lot more transparent and educative with especially young women so that they are aware that side effects could happen and then report it and understand that something could go wrong. So in this latest study, they're saying 1 in 10 women were found to have, quote, severe adverse effects after using mifepristone because it had 22 times the side effects of the FDA-approved label. Now, these studies have limitations, but the mifepristone blocks the progesterone, and you need progesterone for the pregnancy. And when you want the pregnancy, when you want the baby, your body, God willing, it works correctly, will ovulate the egg. The egg will come out. The sperm will come. They'll meet in the tube, the fallopian tube. They will coalesce. Okay, right, become a zygote. A fertilized egg then comes down the fallopian tube, lands in the uterus. In order for there to be a nice amount of cushion, and vasculature, your progesterone after your ovulation starts to rise. And your progesterone will rise to make sure there's that cushion and make sure there's that support. If you don't get pregnant, there's signals to the brain that then tell the brain, okay, slough it off, and that's when you get your period. But if a signal tells the brain, well, she's pregnant, so don't be sloughing anything, then your progesterone continues to grow and continues to get higher. And so you need progesterone for a baby to work. Many women in my family who miscarried, many patients, I had noticed that they were losing they didn't have enough progesterone to keep the baby. And so one test I would always run if I newly diagnosed somebody being pregnant is I would check their progesterone. And if I saw they had low progesterone, I would immediately inform the OB. I go, look, I'm going to be sending you a new pregnant patient. She's really early, but her progesterone is low. And oftentimes they'd have me start the progesterone early just to be able to help maintain that pregnancy. So you need progesterone. You do. So the mifepristone, how these abortion pills work is the mifepristone blocks the progesterone. So if you don't have the progesterone, you'll start to slough. The misoprostol will cause the uterine contractions and bleeding to allow the fetus to expel, or the fertilized egg to expel. Research by the Ethics and Public Policy Center in D.C., and I'm sorry for the very simplified version of that I only have X amount of time per segment to go into all the pathophysiology and embryology of it. But according to this study being reported by Fox News, research by the Ethics and Public Policy Center in D.C. has revealed that the rate of serious side effects is 22 times higher than what was indicated on the FDA drug label. They said 11% of women reported infection, hemorrhaging, or another serious or life-threatening adverse event. Now, the study looked at insurance claims data that included more than 865,000 medical abortions prescribed between 2017 and 2023. This is one of the largest ever data sets. And they say, by contrast, the current FDA-approved drug label is based on the results of 10 clinical trials of 30,000 women. Less than 0.5% had reported severe adverse reactions. And some of those studies were done, they said, as long as 42 years ago. So if you're having an obese woman, if you're having a woman with a much different, shall we say, hormonal makeup than a woman 42 years ago, there might be different data. But because they said this data set was, maybe 20 to 25 times more than the original data set, they were able to pull some very interesting data, and they said the results were truly shocking and a sad reality. But they said they weren't exactly surprised by these findings because other studies with smaller data sets found significant safety problems with chemical abortions. So what do we do with this? Well, if somebody is suffering from, I think the Guttmacher Institute also had a study looking at severe complications in some, not everybody, from these abortion pills. We need to educate the public that now that we have these prescriptions, where you could just go and get an abortion pill, that doesn't mean you don't have a doctor overseeing it. It doesn't mean you don't follow up. It doesn't mean you understand that there could be some serious risks. To expel a pregnancy is not something the body wants to do lightly. And, we pop pills for everything. And because we want to fight nature, we want to fight the way our body does things. We want to live longer. And, I'm very grateful for the pharmaceuticals we have. But when I talk to young girls who are sexually active, asking for birth control and I'll always ask them, okay, now that you're sexually active, I want to make sure you're thinking about everything. Are you using protection so you don't get an STI? What happens if you become pregnant? Well, I'll just get an abortion. The number one answer I get from a teenager, what happens if you get pregnant now that you're sexually active, is I'll just get an abortion. And they say that as it's the easiest thing, like putting a stamp on an envelope. And so I think people have to be aware that, it's better to not get pregnant. In fact, I can't tell you how many teens will tell me, I don't want to use protection. That's why I'm coming to you for birth control. Duh, boomer. One, I'm not a boomer. Okay, I'm a Gen X. But two, no, you still need to use protection. If you're going to be on birth control to prevent pregnancy, that's not going to protect you against an STI. You still need to be using condoms. You still need to be using protection. So I think there's a lack of education, and this lack of education is growing if we are seeing, schools not necessarily go into sex ed with that focus. I know there's a lot of other focuses these days now, but those were the things that used to be taught, and kids would go to their doctor. If you wanted birth control, you would have to go into your doctor. I'm grateful that there is birth control over the counter for people who need access to it, but now they're not getting the pelvic exam. They're not getting the pap smear. They're not getting STD checks, and they're not getting the education. And so when a teenager would tell me, I'll just get an abortion, I explained to them what that abortion was and why you probably want to avoid the unwanted pregnancy, as opposed to thinking, well, that's okay, I could just trade it in, or I could just, refund the gift. It's a little bit more complicated than that. And hemorrhaging, infection, scarring, even though the pills have been found to have fewer complications than surgical abortions, you're not, scot-free. So you need to, we need to take this data, talk about it, introduce it to individuals, and help them understand that even though we have increased access to abortion, it's not the safest thing out there, and that try to avoid the unwanted pregnancy is obviously the most safe. 1-877 Doc Dolly, don't go away. We are back on the Dr. Dahlia Show. Thank you all for tuning in. 1-877 Dr. Dolly, 1-877 DOCDALI. Big thanks to Talk Media Network for making the show happen. Big thanks to Daniel, our producer. Big thanks to y'all for tuning in. We really do appreciate it. Don't forget to follow us on Twitter or X at Dr. Dahlia, Facebook, The Dr. Dahlia Show, and on YouTube. Click like and subscribe. So as you know, I suffer from migraines. It was horrible. I mean, I could not even describe that pain. I think kidney stone pain was less than some of the migraine pain I'm having. And there's a lot of different types of headaches. Sometimes we, call it a migraine, but there's other types of headaches. We got cluster headaches, we got cervicogenic headaches, and there's not a lot of treatment options available, especially for the very common cluster headache. Now, we do have a lot of medications for migraine, but it's not a one-size-fits-all. Approximately 43 million Americans are living. Now, there is a fantastic injection. It's the first and only FDA-approved dihydroergotamine, DHE auto-injector for the acute treatment of migraine with or without aura, and the acute treatment of cluster headaches in adults who have it. And this is soon going to be available for patient use. I'm really excited about it. Now, to speak on this is Dr. Alan Rappaport, migraine specialist, who we are really, really grateful to have. He's a distinguished neurologist and professor of neurology at the David Geffen School of Medicine at UCLA, where I trained, and he teaches residents that he's been doing since 2006, also teaches at Cedars-Sinai Hospital, where I was born. So we're connected. Dr. Rappaport, thank you so much for joining us.
Well, thank you for having me. I'm glad I'm speaking to a Californian.
Amen to that. Absolutely. So migraines and cluster headaches. Can you talk about the difference and then why they're so difficult to treat?
Sure. Thank you. So migraine is a headache that occurs more in women than men, about 3 times more in women than men. It's probably inherited most of the time, and it occurs about 1 to 3 times a month on average. It can be much more frequent or less frequent. And during a migraine attack, a pain starts and builds over a period of a few hours, sometimes faster, and it's often on one side of the head, in the front of the head. It's a throbbing pain associated with nausea and vomiting, sometimes also light sensitivity, which really bothers people a lot, sound sensitivity, and a lot of disability. And people can't really work during a migraine. They can't really think well. They can't speak well. They'd rather lie in bed with the blinds closed and do nothing unless they get good treatment. And as you mentioned, there are a lot of treatments, but there's some problems with the treatments that we have. Most people like to take pills because it's easy, and doctors like to give pills because they don't have to describe too much. And what happens when you take a good pill for migraine? Sometimes it knocks it out and you're fine. A lot of people find that it doesn't work that well, or it works, but the headache recurs in several hours or the next day. And when that happens, I realize that the pill isn't getting down the GI tract to the area where it gets absorbed into the small bowel, and the headache will recur or not even get better. So for migraine, I would think about Perkia auto-injector for someone that doesn't stay well when they take their pills or medicines, however they take them, or doesn't get all better, because DHE, which is what's in it, dihydroergotamine, just like you said, is an ergot, which is a vasoconstrictor, and it's been around 70 years. And we know it well. It works well. I used to hospitalize patients and give them IV DHE all the time. And the trouble is, you have to give it by injection for it to work really well. It does come as a nasal spray, but I prefer an injection. And when you have a bad migraine, you can't get to the ER. You will if somebody will drive you. You can't get to my office. So to have an injection of DHE at home is something I've waited for over 10 years. It's available today. It was released just a few weeks ago. And the only thing that's really special about how to get it, you can't just go to the pharmacy and get it. You have to have your doctor or nurse prescribe it from one of two specialty pharmacies, either Walgreens Specialty Pharmacy or Sterling Specialty Pharmacy. So that's the way you have to get it. But it's really something that I'm waiting for. I've been waiting for.
And like you said, also, we see a lot of migraines, affect both men and women, but predominantly women, and cluster headaches. We see them also predominantly affect men. So this also can help with cluster headaches as well.
You're absolutely right. And as you know, we have very few really good medicines for cluster. There is a triptan that you can take subcutaneously for cluster, and when it works, that's great. But I want to tell people that cluster is a little different from migraine. When it comes, it's in and around one eye. That eye turns red. It starts tearing. You may have a stuffed or running nostril on that side. And the pain is excruciatingly severe. Migraine's bad enough, as you know, but cluster is probably worse. Patients can't sit still with it or lie still. They rock back and forth. They run. They bang their head on a wall because that feels better than the pain itself. They feel as though something's pushing their eyeball out of the socket. It's just a horrible, horrible pain. The good news is it only lasts for 45 minutes to 2 or 3 hours, whereas migraine can go a day or two if you don't treat it well. The bad news is it recurs 3 or 4 times a day, and even in the middle of the night. And it happens most days for about 6 to 8 weeks, and then it goes away. And it comes back a month later. Not a month, sorry, a year later. So cluster is really tough, and it's different. And as you say, it's more men, and it's pretty rare. It's 1 million people in the country have cluster. But if you have it, you will do anything to avoid it or to treat it, and you'll go any place for it.
Absolutely. And of course, make sure you don't self-diagnose these types of headaches. Everybody make sure you have a medical provider, because unfortunately there's lots of other things that could mimic these headaches. But, once you are officially diagnosed with migraine or cluster, this Brachia auto-injector sounds exciting. I know we're running short on time because you're very busy, and we're so grateful to have you. What other information would you like to share with our listeners?
Great question. So there are a couple of types of people that shouldn't take Brachia auto-injector. If you're on a CYP3A4 inhibitor, like a protease inhibitor, if you got AIDS and you're taking one of those, or if you take a macrolide antibiotic for some reason, you should not take Brachia autoinjector. Don't use it if you have bad ischemic heart disease or controlled hypertension. If you're taking a triptan or an ergot for migraine, if it's working, keep doing it. If it's not working, don't take it on a day you're going to take this, because the two of them don't work well together. If you're pregnant or breastfeeding, don't take it. And if your blood pressure is very high and the doctor has trouble controlling it, don't take it. There are a few side effects I warn people about. Sometimes nausea, sometimes it'll increase your blood pressure, and some people may get heart or cerebral ischemia. It's very easy to take and very convenient. You get your anterior thigh, the front of your thigh should be available. You can use 3 in a day, although I rarely have to do that. And you can use 6 in a month.
Dr. Rappaport, I am so glad you came on. One more time, where can my listeners go for more information?
They can go to Brachia.com. That's BREKIYA.com. Or you can go to the company website. The company is Amneal. That's AMNEAL.com. And you can get more information, and it's available today.
Love it. Gosh, Dr. Rappaport, can't wait to have you back. God bless, and thank you for this segment.
Oh, you're very welcome. You did a good job. Thank you.
Awesome. All right, guys, don't go away. We'll be right back. 1-877-DOC-DOLLY.
Hey guys, it's Clyde. You know, we've had a lot of requests for Ground Zero merchandise, so we put together an online store with a big variety of high-quality items. I'm really excited to let you know about these things. We have a lot to offer you and your loved ones. In addition to our regular apparel, such as t-shirts, beanies, hoodies, and hats, we've expanded our product line with posters, flags, aprons, mugs, and a whole lot more. We also have Ground Zero collectibles, along with a limited edition of items like a Clyde Lewis canvas portrait, a Ground Zero embroidered jacket that will certainly make for great gifts and for interesting conversations with family and friends. And we now offer publications such as Ron Patton's book about mind control, MK Zine, and back copies of the official magazine of Ground Zero while it was in print. Paranoia, the Conspiracy Reader, also coming in 2023, are updated and revised books that I've written. There's a secure and easy-to-use shopping cart for your purchases. So shop today at our official store by going to groundzeromerch.com. Again, that's groundzeromerch.com.
Hey, America. How tired are you of mainstream corporate media's biased narratives and manipulated news? Their dishonesty and attempts to influence this generation have been exposed, put on display for anyone who's even half paying attention. But the New American Magazine has been an honest source of news and commentary for over 50 years. This is your opportunity to receive the stalwart of principled journalism at a deep discount. Picture a beautifully published magazine arriving at your doorstep twice a month, packed with insightful stories written with integrity. It's also available digitally on the New American's mobile app. Get up to speed with intelligent coverage from a freedom perspective. Right now, for a limited time, the New American is available to radio listeners at a 25% discount on a new subscription. Visit thenewamerican.com/radio25 and receive 25% off. Subscribe today at thenewamerican.com/radio25.
Looking for an easy read that can actually help secure someone's future? Pick up a copy of Mark Falter's book, Common Sense Income Strategies. For the past 30-plus years, Mark has helped thousands of hardworking Americans secure their financial future by using strategies that continue to create wealth, whether the market is up or down. Strategies that will make perfect sense once you take the time to read this powerful book. Common Sense Income Strategies brings to you what Mark has been teaching in person and talking about on the radio for decades. It's not rocket science, it's a pretty easy read. You've worked too long and too hard not to see the fruits of your labor. Common Sense Income Strategies is available now on Amazon or by calling 866-764-2635. That's 866-764-2635. Common Sense Income Strategies by Financial Fitness Show host Mark Falter. Secure your financial future today.